Hello, our guest is Michele Mischler, Head of Swiss Public Affairs of World Economic Forum from Geneva, and we'll discuss the current situation in Switzerland. Welcome to Medyascope, Ms. Mischler.
Thank you. Nice to be here.
Thank you. So Switzerland is one of the countries most affected by the coronavirus, with more than 850 deaths.
Yeah.
So can you please tell us the current situation in Switzerland?
Okay, so on March 16th, the Swiss Federal Council called in the extraordinary situation according to the Swiss Epidemics Act. And basically what that meant is that they shut down all non-essential businesses. So for the last month almost, Swiss people have stayed at home, haven't really gone to work, except for those working in grocery stores or people on the front line in the health system. So we have a little bit over 22,000 people infected, and as you mentioned, around 850 deaths. Now, to put that into perspective a little bit, Switzerland also is one of the countries that has done the most testing, so about almost 20,000 tests per million, which is quite high. I think we're in the top 5 of countries that have been testing. And also the deaths that have occurred in Switzerland, the mean age of those has been 83.
So please go on.
Yeah, so basically most of the people that have unfortunately passed away have been quite old. And also, I just saw some stats today, about 98% of those people that were of that age range and that have passed away also had previous health conditions. So
please,
go on.
Please. You can go on.
No, that's it. That's fine.
Okay. When you look at the list of the countries most affected by the coronavirus, we see that these are the countries with more population relatively to Switzerland. So why did the virus spread that much in Switzerland?
Well, I think one of the reasons is because we are attached to Italy, and Italy was I guess one of the first country in Europe that really had that got hit by this virus quite heavily. Then also Switzerland is a very pragmatic country, so we kind of did things a little bit step by step, kind of watched a little bit first, and then when we saw how things were going in Italy, then the Swiss government decided to slowly then shut things down. But I mean, we're in Schengen, all the borders are open. There's a lot of traffic back and forth. You know, so I think it's and it's also there's massive population per square meter in Europe. So I think it was very difficult to kind of keep it contained in Europe. So that's why you see the various countries in Europe suffering quite strongly from this.
So Switzerland is a federal state. So what's the difference between the measures which have taken from the federal state or the cantons?
So basically the federal government, everything that the federal government, all the measures that they have put in place, the cantons have to follow. Some cantons took things a little bit further. For instance, in one canton, they put a quarantine on people over the age of 65, saying that they couldn't go out anymore. And that's one of the things that Switzerland kind of stopped short of. There is no quarantine. You can still go out. You still can go, go running or go down to the lake or whatever. You're just not allowed to be a group of more than 5, and you have to have the 2-meter distance. So when Uri, this is the canton that did this, put this into effect, then the federal government said, listen, you can't override us. So there's been back and forth between the cantons and the federal government. I think the collaboration has been very good. The federal government saw the concerns of some of the cantons and wanting to take things a little bit further, but they've remained quite strong. What they have done is they've given some exceptions for cantons, for instance, like Ticino, if they want to shut down certain construction sites. Yeah, you can cut this, right? You can edit this.
Oh yeah, of course. Yeah.
Okay. So the Swiss government has given exceptions to some cantons like Ticino to shut down certain industries like construction sites, that sort of thing. But they have to apply for it, and it has to be extenuating circumstances.
Okay, is public opinion positive or negative regarding the measures taken by national or local governors or officials?
Yeah, I think I just actually recently saw a survey on that they have done, and actually most of the population supports it. The majority supports the measures that have been taken. A small percentage thinks that they should have even gone further, but the general consensus is that it's well accepted, because I think the Swiss government is very pragmatic. They've also been extremely transparent and forthcoming with their information, holding press conferences the first 2 weeks pretty much every day with the various departments involved, giving information and explaining the things that they're doing, the money that they're infusing into the economy, putting up 40 billion francs of help for small businesses. So I mean, they've done, I have to say, I'm quite impressed. They've done a really, really good job of being very communicative and transparent with everything.
So Switzerland has kilometers of borders with France and Italy, and at the same time have deep relations with Italy and France. And when we look at what's going on in France and Italy, a lot of people are dead until today. So do Swiss people compare themselves with French and Italian people and say we're better than them or something like this?
No, not in a situation like this. No, I think they're just glad that the government has, put the measures that they have. I think we're thankful that we have a strong healthcare system, because right now it is in really good shape still. We are not overburdened at all. We are bringing in people from France, where in the French areas where they don't have capacity anymore. We're bringing in people, from other countries. So no, I mean, I have not seen that at all.
Okay, let's talk about more about the healthcare system of Switzerland. You said that it is better than the other countries, especially the countries like France or Italy. Can you please tell us the healthcare system in Switzerland?
Okay, well, I don't think I said it's better. I think we've just been lucky. We do have a strong healthcare system, and we've just been lucky that the Swiss people have listened, have stayed in quarantine. We have enough beds, we have enough intensive care beds, and I think the measures were taken early enough so that the healthcare system didn't become overburdened. Again, France has an excellent healthcare system, as does Italy. I think we're lucky, and that it didn't get out of hand as quickly as it did in the other countries. And for now, the funny thing is actually some of the private hospitals, actually some of their workers and the doctors have to go on unemployment or on what they call short-term work support, because there's no work, and they've canceled all the operations or unnecessary things in order to be available for the COVID run-on, which hasn't really happened.
In most countries, people are scared of the future because of the economics, but we know that Switzerland has a strong economy. Regarding the economy, do people fear of the future in Switzerland, or are they more comfortable than the other countries?
I think there's a certain level of anxiety as well in Switzerland. I mean, yes, we are a country that does very well. We have a very risk-averse fiscal policy, so that did give the Swiss federal government kind of a buffer to be able to help people. I think we're in better shape than a lot of other countries, but the anxiety is still there, because it's also not just Switzerland. I mean, the global, the impact globally is also then going to have an impact on Switzerland, of course. So while we have a buffer as a country, the global situation will also, of course, have an impact on us. So there's definitely some anxiety.
Okay, thank you so much, Michele Mischler.
Pleasure.